Hi, welcome to Medical Coding Club. So as I promised you all earlier that I'm going to give you notes from all series. So today I'm going to discuss about adjacent tissue transfer from integumentary system. So let's start. So from integumentary system, these are the important topics. So in these topics I have discussed IND and I guess repair. Remaining I have to discuss that I will definitely going to update those notes. And today we'll see important topic ATT. So what is adjacent tissue transfer? It means adjacent tissue transfers involves it rearranging and transferring a local area of skin along with the underlying subcutaneous tissues to repair a defect. The defect repaired may be a traumatic wound or injury or maybe defect left after excision of a lesion or a mass. So it's just provider will transfer the healthy skin to defected area and they will close the area with sutures. So this is a concept. There are many techniques or types involved in this adjacent tissue transfer that are rhomboid flap, rotational flap, advancement flap and VY-plasty, Z-plasty, W-plasty, and we'll see all these techniques. First, we'll see coding guidelines for ATT before getting into techniques of ATT. So these are the guidelines which coder has to follow when it comes to ATT. So firstly, look for anatomical site belongs to which anatomical group. So you should be able to find out the site, which it is belongs to which anatomical group, and then code for the each site separately even though ATT performed on a different site on the same body group. For example, in the same body, like a right arm, there are three other sides ATT performed, but you should code each side separately. And then, if incidental trauma closed with ATT, we have to code with appropriate repair codes, not with ATT codes. Okay, then if simple repair and excision of lesions performed, we have to code only ATT. Why? Because simple repair and excision of lesion is included in ATT. And if the edges of the wounds are undermined, for example, lifted up or mobilized without creating any additional incision, the provider is not making any incision, they are just lifting the edges or doing some small workup, then it's not a adjacent tissue transfer. This it will lead to some other series code. Okay, and then you have to know this, that area of ATT means area of primary defect and area of secondary defect, and the area where the lesion is excised called primary area or primary defect, and the area by physician damaged by the physician called secondary area or secondary defect. So this everyone should know this. So next will be types of ATT. So there are many types. The important types are W-plasty. That means an adjacent tissue transfer technique where additional incision in the shape of letter W are made. Okay, this suture will be done in the shape of W. The incision, the procedure will be done in the manner of W. So it is called W-plasty. When it comes to Z-plasty, it resembles the letter Z. You can see the image. And then VY-plasty, that means it resembles the letter V or Y, to create the flap. They will make a flap in the shape of V or Y. And next will be rotational flap, random island flap, advancement flap. You can go through the definition, you will definitely get to know. Rotation flap means they will just create the flap next to the defect, then they will rotate the flap, so it is called rotational flap. And we'll see the code set. Okay, when it comes to a trunk, these categories comes uh, you know 30 square meter, less than 30 and 30 square centimeter. So when it comes to a trunk, adjacent tissue transfer of the trunk, the CPT codes will be 14000 and 14001, and same as scalp, arm, legs. And the next category will be forehead, cheeks, chin, mouth, neck, axilla, and genitalia, hands, feet. So this is, you should remember, that is less than 30 square centimeter. And then you can go through the code set as well. Then eyelid, nose, ears, lips, it will be CPC, CPT 14060 and 14061. And then the larger than any area which is larger than 30 square centimeter, we will code these two codes. Okay, 14301 and 14302. So it's just an overview. You can easily understand the code set. And next will be, I have given the example here. So here you can see a 55-year-old patient present with a traumatic laceration that is 8 into 3 centimeter. That means 8 centimeter length and 3 centimeter width. Okay, on the right forearm. After a sterile prep and rep, WO-plasty relaxing incisions were made. So here the technique is WO-plasty. And then the edges of the wound came together nicely, allowing us to complete our adjacent tissue transfer over the entire wound surface area. You can read the question and the rationally given below. You can go through that. So here the concluding the W-plasty and 8 into 3 centimeter, that is when we are multiplying that, what is that, length and width, it will comes to 24 square centimeter. So the CPT code will lead to 14021. So it's first one, when the ATT comes, you should remember what are the techniques and anatomical site, so you can easily code the scenario. This is that's all for ATT. Remaining concept I will upload later. So thank you for watching. Please subscribe my channel and support me through the tough time. I'm doing it for you guys. So please. Thank you.